Welcome to Central Health Talks on KZI FM 88.7. I'm Anastasia Sims, Central Health Multimedia Communications Supervisor, and I'll be your host for the next 30 minutes. Central Health is the Travis County Healthcare District. We provide access to care for 1 in 9 Travis County residents. We work with a network of partners to eliminate health disparities and reach our vision of Travis County becoming a model healthy community. Community Care Health Centers is a separate but affiliated organization to Central Health that provides medical, dental, behavioral health, and prescription services throughout Travis County's largest networks of FQHCs. Just to open with our discussion and main topic for today, just when we thought the worst of the COVID-19 pandemic was over, experts are warning of a triple-demic coming this holiday season. This trio of viral threats includes RSV, flu, and COVID. Together, these viruses are causing an increase in the number of people going to the ER. In response, our partners at Community Care and Carousel Pediatrics are expanding capacity and hours to see patients for non-emergency healthcare needs. Joining me this morning to talk about respiratory illnesses that are impacting patients, specifically children nationwide, is Dr. Tara Grindike of Community Care. Please introduce yourself, Doctor, and tell us a little bit more about Community Care.
Good morning. Thanks so much for having me. I'm really honored to be able to chat with you this morning. Just as you said, my name is Tara Grindike. I am a pediatrician. I have been serving in the Austin community since 2010, and I work over at Community Care East Austin Health Center.
So what is the triple-demic and why is this happening now?
Great question. With the pandemic, obviously for those 2 years, especially the first year, but really for the second year as well, it's safe to say, I think, that we all remember hunkering down. We stayed home, we socially distanced, we avoided crowds, schools weren't open for a large part of that time, children didn't go to daycare, many of us started working remotely from home. And obviously we did all of that to make it as possible to keep the COVID numbers down and keep our hospitals from being overwhelmed. One of the other things that happened, and we were noticing it as it was happening, was that as children were not going to school and weren't going to daycare, children weren't getting the usual respiratory illnesses that we're used to seeing children get every winter. I think any parent is familiar with the back to school and back to being sick season. And so there's a general cycle of respiratory viruses that we as pediatricians and parents are accustomed to seeing every year. And we really didn't see that for that year or two during the pandemic. And actually, interestingly, for pediatrics, obviously COVID has been a serious illness for everybody in society and for children included. We were one maybe slight silver lining is that a lot of the other respiratory viruses really went quiet for a while. There were people, pediatric experts during those couple of years that were predicting that when we went back to business as usual as a society, that we were probably going to see these viruses that were real quiet. They were kind of hiding, waiting to come back, that we were probably going to experience a really big surge. And that is exactly what's happening. So, it's normal for kids to get sick. It's kind of part of the process of growing up. You get sick, your immune system deals with the virus, and then your immune system builds up protection for the next time it sees that virus or other viruses. So for those 2 years, for those children who weren't getting exposed to viruses and weren't getting sick, it's like their immune system just wasn't getting to know the world. And so what happened is now those immune systems are getting to know the world in a big way. And we are seeing not only the regular winter season that we would see, but it's now being sort of compounded or, magnified by the fact that you have so many children that really just haven't experienced being sick with a respiratory illness before. So all of that has to do with what's going on. And there's probably other factors that we may not understand now, and maybe we'll understand in 5 or 10 years after researchers have a chance to study it. But that's what we know so far.
So tell me a little bit more about RSV specifically.
So RSV, respiratory syncytial virus, is a well-known virus to pediatricians. Every winter we expect to see cases of RSV. It's one of the most common reasons why babies and young children are hospitalized. In the name, it's a respiratory virus. It causes anything from what could look like a mild cold, runny nose, and cough, to something as severe as real difficulty breathing and needing to be in the hospital to receive oxygen and support to breathe. Sort of anything from one end of the spectrum to the other end of the spectrum. The younger you are, the more serious RSV is. If you or I get RSV, we likely would never know. We might have a sniffle. Maybe we'd get a cold or a head cold and feel a little crummy for a few days, but we would likely never even know we have RSV because it's really not necessary to identify it in you or me. A young child, and especially a child younger than 6 months, and a baby who was born premature, those groups are really at high risk for getting pretty sick from RSV. RSV just causes a lot of inflammation in the lungs, and that's kind of fancy talk inflammation for a lot of mucus, a lot of coughing, and therefore a lot of difficulty breathing. And the younger you are, the smaller your nose passages, your throat passages, all of the passages in your lungs are. And so all of that mucus and inflammation has a greater impact on your ability to breathe. That's why we see young children and infants specifically get so sick from RSV. Unfortunately, we don't have any magic cure for RSV. There is a special treatment that babies who are premature can qualify to get, but the vast majority of babies and children are not going to qualify for that. It's not a magic cure in and of itself, and it's called Synagis. But aside from that, there really is no other treatment for RSV other than what we call supportive care. So what is supportive care? Supportive care is really a pediatrician's best friend. That means we guide a parent or caregiver to do the things that they can do at home to help support the body while the body does the fighting. Really, truth be told, for most illnesses, your body does most of the work, and that's not any different for children and young babies. So when a baby or child gets sick with RSV, we talk about a few things. We talk about making sure they remain hydrated. So for an infant, that's going to mean making sure they continue to take their formula or breast milk. For an older child, it'll be making sure that they continue to take liquids, because we really want to make sure that they don't become dehydrated. Becoming dehydrated is another problem that often accompanies RSV, or really a lot of illnesses in children, and that can become a situation that can make everything worse. So we want to make sure that the child remains hydrated, and that means that the parent is sort of watching out for that. The other thing that we want to do, especially in the young babies, as any parent or caregiver knows, it's really hard for them to clear their mucus, right? They don't blow their nose. They might have a difficult time when they're coughing, sort of coughing up all that phlegm and getting it out. So a parent can help with that, with suctioning them. There are, devices one can buy in the pharmacy, suction bulbs, other things that can help a parent do that. That's really important. And just, sort of keeping an eye on your child, which any good parent or caregiver is always doing, and watching out for those things that might be telling us that the situation is getting more serious and it's time to maybe seek some medical attention.
So how do I know if my baby has RSV? Is there a test? Do I have to come into the doctor? Can I just see it for myself? How do I know?
That's a great question. There is a test for RSV. It's not universally available at every doctor's office, but it usually is available in a hospital setting. Some doctor's offices have it, but not everybody does. Truth be told, you might know your child has RSV or your baby has RSV because it's the time of year or the season, for example, right now when it's very commonly being passed from child to child. You might know because maybe your daycare center tells you that RSV is going around the daycare, so forth and so on. And because RSV, while, like I said before, it can look like a mild cold, and so maybe that doesn't really seem like anything too specific. In a young baby, if they start having a lot of nasal congestion, a lot of cough, a lot of wet cough, and sort of progress to having a little bit of difficulty breathing, many times it will be RSV. You can sort of tell it from, it walks like a duck and talks like a duck. It's probably a duck. That's a little bit how we think about RSV. And in terms of coming into the doctor, it's always a good idea to have your child or infant be evaluated if you're worried, and your doctor can certainly help you figure out if that's what's going on.
So, as a mother of twins, I have been giving our young children lots of oranges when they get sick, saline drops, and suctioning their nose. But what are some pediatrician approved home remedies and home treatments?
Oh, that's a great question. So again, there's no magic cure for RSV. There's really no magic cure even for the common cold, right? As we were just talking about. So what are some safe things to do? The American Academy of Pediatrics does not support using cough medicines in children. Absolutely not using them in children under the age of 2. I would say that I really don't recommend them under the age of 6. And truth be told, cough medicines are not cures for the common cold or for the cough. And so I really advise against them most of the time. Suctioning is really an important part of it all. Like I said, the hydration. People love humidifiers. Just make sure your humidifier is clean, you're using clean water, and the machine itself is clean. That can be helpful. Some people like to put menthol, sort of menthol preparations in them, and that can be helpful as well.
We have to take a quick break, but when we come back, we will continue the conversation about the triple demic and how it's impacting the nation's children.
Thank you.
Support for Central Health Talks is provided by Central Health, the Travis County Hospital District. Central Health creates access to healthcare by funding the Medical Access Program, MAP. MAP enrolls low-income, uninsured, underinsured Travis County residents by connecting them to a broad network of providers and other healthcare services. If you or someone you know needs healthcare, you may call 512-978-8130 or visit applyformap.net. Before the break, we were discussing RSV and flu. Dr. Greendike, can you tell us where patients can go through community care if they need a same-day appointment, or what are the services that community care is providing to address the need in the community?
Yeah, happy to answer that. Community care is really stepping forward to be a partner in the community right now and make sure that we are offering our patients and families what they need. So, as you know, probably community care is comprised of over 28 clinics in Travis County. And we have really upped our game in terms of making same day access for families, and specifically for families with children who are sick, more possible right now. We are really trying hard to ensure that our families, if they don't need to be in the emergency room, feel like they have a place to go. And we understand when your child is sick, you need to be seen that day. So that's really what we're aiming to do. So people can visit our website, communitycaretx.org, and it very well delineated there sort of where you can find our phone numbers and access points for getting appointments. And I just want to also take a opportunity to stress that community care is a federally qualified healthcare system. Our mission is to serve our community and to be there for our community. So we are really wanting to provide that access and be the support that our families need right now, especially those with low income, with or without insurance, vulnerable communities. There's really no one that we don't want to be supporting right now.
So we've been discussing RSV, but when should a parent send their child to the emergency room versus the urgent care versus going in to see the doctor?
Great question. In general, and this would really apply to any time your child or baby is sick with a respiratory illness, not just RSV. If what you're seeing at home is that your child is congested, is coughing, but is able to, let's say, take in their formula or breast milk or normal diet, maybe a little less than usual, but they're able to do it. Maybe they have fever, but they are not too bothered by it. They're not too lethargic, meaning they're, generally speaking, kind of themselves, maybe a little bit tired, but not unresponsive or something more serious like that. all of that are, sort of signs that you can probably manage what's going on at home, right? Making sure they're staying hydrated, making sure they're breathing comfortably. With respiratory illnesses, it's quite common that infants and children will start to breathe a little faster and harder than they might do normally. We start to get pretty concerned when an infant or child is breathing faster and harder than they normally do for a sustained amount of time, meaning not just here and there, but you're looking at them and it's going on. It's not really stopping, right? They're just continuing to breathe harder and faster. So what does that mean, harder and faster? Faster, I think, kind of is self-explanatory. Harder means that, usually when somebody's breathing comfortably, you don't really notice them breathing, right? It's not something that you notice. When someone, especially a child or infant, is breathing harder, you notice every breath. You might notice their muscles around their rib cage sucking in with every breath. You might notice at sort of the nape of the neck that there's sort of a sucking in that's happening. You might notice that they're flaring their nostrils with every breath or making a sound sort of like a grunting with every breath. All of those are indications that your infant or child is working hard to breathe, right? Usually breathing doesn't take any work, or really doesn't take any work that you should be seeing with your eyes. So the more that you're seeing that, the more that tells you that your child is working hard to breathe. And that may or may not be an emergency, right? The more the sort of the harder it is, meaning the more of those signs that you're seeing, from the nostrils flaring to the sucking in of the rib cage, for the longer that you're seeing it, that is the indication that it's getting serious and may need to be evaluated by a physician. Now, when do you go into your doctor's office versus when do you go to the emergency room? At the end of the day, I like to tell parents and caregivers, you are the professionals with your children, and right? I'd never argue with a mother who thinks that what's going on is an emergency. I would never talk her out of it, right? So I think that's an important point. What we do know is there's lots that can be done at home, like we've already spoken about. And there's also times when what you're seeing definitely needs to be evaluated by a medical provider, but may not need to be evaluated in the emergency room, right? So if what you're looking at is your child or infant is breathing faster or harder, but it's maybe coming and going, they're still drinking okay, they're sort of acting like themselves, maybe a little bit more tired, but not anything really unusual, that's a good opportunity to come into your medical provider's office and have them evaluate your infant or child. And they should be able to help you decide whether or not what's going on needs to be evaluated in the hospital, or whether we can kind of continue to manage it at home. If what you're seeing is fast, hard breathing, that's not slowing down, that's not stopping, your child is really, or your infant is really not behaving like themselves, very high fever for a few days in a row is also something to be watchful for. If a child has a high fever one time, it comes down with medication and doesn't come back, that's one thing. But if it's sort of sustained and not going away, that's also concerning. And again, back to that not drinking, not able to keep anything down by mouth, and becoming dehydrated. So looking like they have dry lips or dry mouth, and again, being very tired. All of those are things that might indicate needing to go to the emergency room. Again, we would really welcome families giving us a call, giving your medical provider a call, and talking through it. You may be able to talk to a nurse and sort of talk through what's going on and get some advice there. Obviously, if a parent is very concerned, we always encourage them to be seen as soon as possible.
So don't want to forget about flu and COVID, the other two respiratory viruses within the triple-demic. The CDC estimates that the flu has already caused 8.7 million illnesses since October 1st. What distinguishes these three respiratory viruses, RSV, flu, and COVID? How are they different?
That's a great question. So, in terms of how any one person could feel with any of these viruses, in some ways, there's a lot of similarities. They're all respiratory viruses. They spread in similar ways. And, some people with COVID feel like they have a cold. Some people could have RSV and feel like they have a cold, and the same thing with the flu. So, sometimes it might not be that distinguishable, but there are things about each one of them that can set them apart. And specifically with children. So, RSV, we've sort of talked about. The flu really is, I like to tell parents and caregivers that it kind of affects you from head to toe. So all of the things you think about, headache, sore throat, maybe some nasal congestion, cough. The cough might be a little drier rather than wet. Body aches, muscle aches, can even make people have vomiting and diarrhea. It really can sort of affect the whole body like I said, from head to toe. And generally, not always, but oftentimes with fever, it might be that people notice that the fever is a bit higher with the flu than with RSV, but none of these are strict rules, right? So the flu, those are kind of the characteristics of the flu. COVID, I feel like our audience probably is pretty familiar with COVID. You know, some people get COVID and feel fine, right? Or some people get COVID and feel pretty out of it for a few days, but maybe their main symptom, you know, in sort of in the beginning of the pandemic was loss of smell. That's a little bit less common right now, but maybe they have just sort of a general feeling of tiredness and headache. Some people get COVID and need to be in the hospital because of the difficulty breathing and the cough that they have. So in children, some of that is similar. So there's some similarities between all of these, but also a lot of differences. And I would say with the flu, especially this year, we are seeing a real increase in the number of cases of flu, unlike I've seen in the last really 10 years, I think, since the last the quote unquote swine flu year that we had, I think back in 2010 is the last time I, as a pediatrician, remember seeing as much flu as we're seeing now. And the flu, I would say, definitely really kind of knocks you out, and can really make you feel pretty crummy.
And what you're seeing as a pediatrician, are most of these patients vaccinated against the flu or
Great
not?
question. So we always know there's room for improvement with flu vaccination. We really encourage everybody to be vaccinated against the flu 6 months and up. We are always working on encouraging our population to get vaccinated, and it's unfortunate that there's a lot of people around us, I think people that maybe you know or I know, who don't get their annual flu shot for lots of different reasons. The thing that's important with vaccines, Anastasia, to remember is that getting a vaccine is not like having a magic cloak that just keeps the virus from touching you at all, right? The power of the vaccine is to hopefully make it so that if you do get exposed to whatever the virus, or in some cases the bacteria is, for the purposes of the flu, we're talking about a virus, is to keep it from making you get really sick, right? From having a very severe illness, or having to be hospitalized, or in the worst case scenario, die from the illness. The power of vaccines is really about that. And I think sometimes what happens, right? You've heard people say, well, I got the flu shot one year and I got the flu, right? Or,
Right.
and that's a common thing that people feel. And what you could say is that, well, how sick did you get from the flu? Were you able to stay home and take care of yourself? That might have been thanks to the flu vaccine, right? That what the illness that you got was mild and maybe would have been more severe without it. So in terms of what we're seeing, we do see kids who get vaccinated against the flu still get the flu. We also see many who are not vaccinated get the flu. And it's just important to remember that getting vaccines in general is not just about preventing any chance that you're going to get it, but hopefully driving down the chances that it's going to be a severe illness or land you in the hospital. And also, the more people get vaccinated, the less that virus can sort of pass around, among us. That's what we saw with the COVID vaccine, right? So the same is true for the flu vaccine.
Does community care offer flu vaccines and COVID vaccines and boosters?
Yes, 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 all of those. We're excited to give our flu shots to everybody 6 months and up. We encourage people to get their flu shots every year, and we're encouraging it right now. Even if you've had the flu, still get your flu shot. Just like COVID, there are lots of different strains of the flu. And so just because you got the flu one time this year doesn't mean you couldn't get sick with another flu strain again. So get your flu shot. We also have COVID vaccines available, and now have the bivalent booster for children 5 and up available as well.
Okay, so tell me a little bit more about the COVID-19 vaccine for kids, like who can get it, and the boosters and how that works.
Yeah, it's a little complicated, the vaccine schedule, but 6 months and up, you can get your primary series of the COVID vaccine, and how many you get varies a little bit depending on which vaccine you're getting. But there's a primary series, meaning you get, sort of the first set of 2 or 3 COVID vaccines, and we can give that starting at 6 months and up. And then a booster dose has been recommended. And just recently, the bivalent booster has been released for children 5 and up. So the bivalent means that it has the power in this bivalent booster, and the reason why we really want people to sort of pay attention, is that it has the sort of two different strains of the COVID virus. So it has the original strain that was circulating when we all got sick way back in the beginning of, rewind the tape to March 2020. And it also has the Omicron strain in it as well. So that's the bivalent part of it, bi meaning two. So we're hoping that this bivalent booster is really going to provide a lot of protection to the population by including both of those strains in it.
So, although public health officials are concerned about the tripledemic, they're not calling for people to socially distance or avoid holiday gatherings, as we did during the COVID-19 pandemic. So, let's discuss some prevention tips before the holidays as we kind of wrap the show.
Yeah. Well, I'm not the one to tell people not to go to their holiday potluck this year. We know how stressful that was, having to sort of refrain from being around each other during the pandemic. With all that said, there's some silver linings having gone through it. We know what we can do to keep each other and keep ourselves healthy. So staying home when you're sick, keeping your child home when you're sick is definitely still part of our toolkit. We know how difficult that is, especially for working families. And so I realize what I'm saying is easier said than done, but staying home while you're sick is really important. Masking, right? I think before the pandemic, I don't know about you, but I didn't really ever think about masking. And so now we know it's something that we can use, right? So if you have to be out and about for whatever reason and you're not feeling well, definitely consider using a mask. Washing hands, we know how important hand hygiene is for all of these respiratory illnesses. Just, before you come, when you leave the house, when you come back in the house, everything you touch in between, washing hands and hand hygiene is important. Teaching your kids to cough into their elbow, all those cute things that we taught kids to do to try to prevent all those secretions from, going all over the place is another great thing. And then obviously the big thing is vaccines. Get your flu vaccine, get your COVID vaccine.
So thank you for joining us on Central Health Talks, KZI FM 88.7. You can continue the conversation with us on Twitter at Central Health TX or like us on Facebook at Central Health TX. Also, you can visit communitycaretx.org for more information about getting a same-day appointment or becoming a community care patient. I'm your host, Anastasia Sims, and thank you to our guest, Dr. Tara Greendike. If you or someone you know needs access to healthcare or one of the services mentioned today, call us at 512-978-8130.